What exactly is it and how does it work?
Sure. Synapse VNA is an organizational content management solution, managing DICOM and non-DICOM. What's unique about what Fujifilm brings is we have experience in a lot of different imaging areas, traditionally radiology and cardiology, but also sonocyte point of care, endoscopy, and non-DICOM areas that often imaging vendors don't have experience in workflow. So the VNA is a content manager that allows you to manage the life cycle of all of that imaging uniquely by department and also handle the physical storage environment. The other aspect of Synapse VNA is the enterprise viewer. So if you're managing all of your content centrally, you then have the ability to have one enterprise viewer through your EHR.
Can you explain the multiple image capture methods, including the Connect app?
Sure, let's take a look. So this is an app that we developed on the iPad that actually allows you to search by patient or encounter if you want a work list for a certain area. For example, dermatology, wound care, those are examples of where you may take a digital photo. And that's the advantage where VNA today can expand into non-DICOM areas and really capture that content that was never accessible previously to an EHR. In addition to the Connect app, which handles really taking over a digital camera environment so that you can use an iPad, other forms of non-DICOM may be HL7. It could be an integration directly with the EHR so that our uploader appears within the EHR for that user, and they can associate imaging directly with the patient with the appropriate information from the EHR and store it directly to the VNA. Other areas might just be a traditional shared drive in a department where, again, you either bring up our browser-based tool or you integrate through an API directly into an application in a department, and that's another way of capturing non-DICOM.
What features and benefits of Synapse VNA are healthcare IT leaders, chief information officers, particularly interested in?
Well, sure. Well, VNA has the ability to expand and eliminate silos in a healthcare organization. So there's radiology and cardiology systems which are DICOM silos or maybe shared environments. But really, VNA allows you to eliminate all of the storage silos that exist in a healthcare organization, which could span across multiple facilities. And the VNA's tools, if you see here on the screen, to create an organizational tree that allows you to set up every area and department in a healthcare organization based on the type of content that will be coming into the VNA and create unique lifecycle management rules and also physical storage policy rules. So a CIO could have a tool that allows them one physical storage environment to scale for the organization and have the appropriate rules and management system so that every department can be accommodated for.
Let's look now at the Synapse Mobility Enterprise Viewer. Can you tell us a little bit about it and show us how it works?
Sure. The Synapse Mobility Enterprise Viewer is a zero footprint viewer that works through the EHR or can be accessed directly. We also have native apps, iPad and Droid operating systems. So what I can show you here is this is an example of the perfect view to be an organizational VNA enterprise viewer. This is displaying a DICOM image in the top left of a chest. You're also seeing non-DICOM images of a scope and dermatology, which would be a JPEG format stored natively and viewed natively in the enterprise viewer. And also you have an example of a video. So a lot of times you'll see videos in surgery or for teaching purposes. And the enterprise viewer gives you that ability to see any type of file format that's stored in the VNA.
The real-time collaboration feature sounds like something that could literally save lives, like in the case of a trauma case, for example. Can you tell us a little bit about that?
Sure. So the collaboration feature is accessible directly from within the enterprise viewer, and we've also uniquely extended it back into our clinical applications for radiology PACS. So a radiologist could access collaboration directly from the PACS environment. But from the enterprise viewer environment, if I want to add to this, I open up my collaboration window, and at this point I have the ability to create an email invite which would give a secure link to another user when they receive the email, they're able to open a session of this viewer looking at the image that I'm looking at. And we both can share controls and collaborate back and forth.
That seems like a really valuable feature that I'm sure a lot of healthcare CIOs will be very interested to hear about. In closing, what's the single most important message you'd like to impress upon our audience?
Well, I think Fujifilm is very uniquely positioned as a VNA vendor. We have over 50 years of imaging experience in healthcare. So I think a VNA vendor really needs to understand the unique workflows of all the different areas in healthcare, because capture and distribution of the imaging and bringing the imaging back to the departments is just as important as the vendor neutral archives capability of managing content. So all of that experience really positions us well to be an overall organization content solutions provider.
Very exciting times for Fujifilm and very exciting technology. Thank you very much, Bill, and have a wonderful HIMSS.
Absolutely, thank you.
I'm Mary Ann Matthews, and that was our Product Spotlight Report with Fujifilm Medical Systems.